Dr. Mercedes Gonzalez. I'm a pediatric dermatologist in Miami, Florida. At the symposium today, I spoke about vascular malformations, and later today I'm going to be speaking about life-threatening vascular lesions in children. Yesterday I spoke about dermatologic issues in the Latinx population. I think one of the key messages that we discussed about during the Skin of Color Symposium was the early recognition of more severe disease. As we spoke about, many times one of the diagnostic features of atopic dermatitis is erythema or redness of the skin, and sometimes in darker skin that is less obvious, and so more severe disease goes under-recognized and is just given topical treatment, whereas it needs more aggressive treatment. So I think we really discussed on focusing on training your eye to see the early signs of severe disease. In addition, there's different presentations on darker skin types, right? So they don't have the classic distribution of the eczema lesions. Many times they'll have spots on their trunk. They'll have what's called perifollicular accentuation, which is a little kind of on the trunk. You have more of a papular feel, and those are all signs that the disease is more extensive and can be more severe. So we really talked about clinical clues to help you distinguish more severe disease in darker skin types. We think about reaching for systemic agents in more severe chronic disease, for example, in chronic atopic dermatitis, once we've really optimized the topical regimen and they're still having very frequent flare-ups that's significantly impacting their quality of life and their ability to perform their daily tasks. So in a young child, that's going to be their ability to concentrate in school, their ability to participate in after-school activities that they want to participate in. If you've optimized the topical treatment with the currently available topical treatments, and despite that, they're still having such frequent flares that it's interfering with their ability to participate in activities in school, that's when we start thinking about systemic treatments and really working from the inside to prevent the flare-ups, so they need less of those topical treatments. Having the cultural sensitivity within the patient interaction when you're talking about any skin disease is very important. Many times these patients are coming in having already tried numerous different treatments that have been recommended by family members who may be affected by the same condition, or traditional treatments that are done in other countries, maybe their country of origin or their country of heritage. So it's really important to get to know your families and ask them what exactly is it that they are using. In addition to the standard treatments, what other products are being used? And in different cultures, there are different practices. So that's why it's a very personal conversation. It's really important to incorporate that into the conversation and get to know the exact names and the exact products that they're using, so that then you can better adjust, educate, and direct the treatment plan. And if you want to learn more about chronic skin disease in patients with skin of color, discuss more about these topics, we are going to be having another Skin of Color Symposium on the West Coast in October. And so I invite everybody listening to sign up and join us there.